Let's talk a little bit about disease microenvironments and systems. The bone marrow microenvironment is increasingly recognized as a driver of resistance, for example. Could you describe how the crosstalk between malignant and immune cells shape therapeutic response?
Absolutely. I mean, one mechanism that we forget sometimes is that in the bone marrow microenvironment, the number of cells are metabolizing even the drugs. So we should not forget that the concentration of the drugs that finally reach the malignant cells is much lower than what we have tested, for example, in vitro and even in vivo models. So one simple mechanism is the metabolism of those drugs, and our colleagues at Johns Hopkins have published extensively about this. The other is as you mentioned earlier, cytokines that are secreted from specific subsets of malignant cells, such as fibroblasts, adipose tissue cells, chondrocytes, and osteoblasts can mediate resistance, so cytokines. And finally, we know interaction, integrins and other molecules that are critical for cells, for this cell-cell interaction, they are also associated with resistance.
Mhm. Are stromal or mesenchymal elements also altered by inflammation in ways that feed back into the myeloid cell survival?
For sure. I mean, the we don't know exactly where this, like, which cells are the sources of this inflammatory cytokines and which ones are the kind of the cells that receive the signal. But we know, for example, that endothelial cells change significantly, and as a result of inflammatory signaling from other cells, pericytes or even glial cells that are in the bone marrow microenvironment. So definitely, we see that inflammation can alter completely the bone marrow microenvironment. And now with the single cell RNA sequencing and even spatial transcriptomics that we are getting, we see that even more, that both during progression of a number of myeloid diseases, but also during treatment, we see significant alterations. So that is key. Now, we don't know exactly what is coming from the leukemia or the myeloid neoplasms and what's coming from the microenvironment, and this needs more advanced models to study.
Mhm. How do you see computational or single cell approaches advancing our understanding of the inflammatory networks at play in myeloid neoplasms?
I think that it's basically we cannot do it without the computational analysis. I mean, this is a huge amount of data, especially the single cell approaches and spatial transcriptomics, that we do require computational biology to understand cell populations and even understand simply which cells change, which cells secrete factors, and how does that affect specifically the leukemia cells. If we base our understanding in the traditional flow cytometry and cell sorting, it's just simply impossible. So I
Mhm.
would say computational biology is definitely required.